Recording. All right, so my name is Keita. I'm the commission work at the Tennessee Commission on Aging and Disability. It's been a long week, y'all. And I'm the nutrition program director. Today, we are going to have our first of hopefully many nutrition webinars. And today we're going to talk about congregate meals. So thank you all for joining. We want to get feedback on this afterwards. I may send out a little questionnaire, short couple of questions just to see how this went over. And if it's something you want to continue, please be honest when you send back those responses. You're not going to hurt my feelings because I want these to benefit you. And if I'm not covering something that is not beneficial for you, then there's no point in us doing this, and it's just a waste of your time. So just let me know if you have any additional things you want me to talk about, or if I need to elaborate more or less or whatever. So I do want to preface by saying that what we go over today is these are all recommendations. I definitely encourage you all to talk to your AAADs and your nutrition, whoever you get your funding from, before you make any changes. I am by no means saying that we are surpassing the AAADs. They are still your main point of contact. That is who you get your majority of your funding from, most of you. So you definitely need to talk to your AAADs and keep them looped in and keep them informed on any changes that you want to make. We're going to go over just some, as you can see, we're going to talk about the Older Americans Act. We're going to talk about just nutrition services in general. We're going to dig down deep into TCAD policy, so Chapter 7. We're going to talk about some OAA updates, talk about some innovative ideas, helpful tips and tricks, and then leave it open for questions. And then again, you're going to have the recording. I want you to be involved to be beneficial. First, we're going to dig down into the beautiful Older Americans Act, or OAA, as we like to call it. So the Older Americans Act is a federal law that was passed by Congress in 1965. It was passed in response to concern by policymakers about a lack of community social services for older persons. The original legislation established authority for grants to states for community planning, social services, research and development projects, and personnel training in the field of aging. Older individuals may receive the services under many federal programs, but the OAA is a major vehicle for the organization and delivery of social and nutritional services to the population and their caregivers. It operates through a national network of 56 state agencies or state agencies on aging, 618 area agencies on aging, nearly 20,000 service providers, 281 tribal organizations, and one Native Hawaiian organization representing 400 tribes. So again, it's a huge, we cover all of the United States. All the rules that we have to follow at the state unit come from the Older Americans Act. The money is federal money coming from federal lawmakers. So these are the set of rules that the state unit on aging has to follow, which then we use those rules to inform our state guidelines. So as you can see, the OAA has changed a bit over time. From the first White House Conference on Aging in 1961 to 1972, when the OAA was authorized funds, and that's when the National Nutrition Program was established. So again, the nutrition part of the OAA has been around since 1972. And then we go into the 1978 is when the adding long-term care ombudsman in. And then we had a reauthorization in 81, focusing on supportive services, to most recently in 2024 with the release of the quote unquote final rule making changes to the act post-pandemic. So it has gone through a wide array of changes. Different things have happened. We added the National Family Caregiver Support Program in 2000. So while the Older Americans Act has been around for a long time, some of our programs and services may not have been around for that long. And we're still learning. We're still getting used to different things. We're going to talk, I said, more into the changes to the Older Americans Act, but it's a robust set of rules that we have to follow to continue to utilize the federal funds. So just wanted to kind of give y'all a brief overview of how the OAA breaks down. So now we're going to dig down deeper into nutrition services, specifically Title 3C. So some of you have heard it referred to as 3C, 3C1, 3C2. In the Older Americans Act, it is broken down into titles. Title 3 is a lot of the titles that deal with older adults. 3C is specifically the nutrition program. C1 is congregate meals. C2 is home delivered meals. So if you hear somebody talk about 3C1 funds, that's dealing with your congregate meals. 3C2 funds are going to deal with your home delivered meals. They are separate budgets. They are separate allotments, just like you all have separate budgets and allotments. The AAADs have separate budgets and allotments. The State Unit on Aging has separate. It comes from the federal government separately. So again, this is not like it's something we're trying to do just to make your job harder. It is the rules. It is what we have to follow. So through the OAA Nutrition Services, ACL provides grants to states to support nutrition services for older adults 60 and older nationwide. So the main goal and purpose of the nutrition program is to reduce hunger, food insecurity, malnutrition for older adults, promote socialization, promote the health and well-being of older adults by assisting them in gaining access to nutrition and other disease prevention and health promotion services. It would be wonderful if we could serve everybody in need, but the goal is not intended to reach every single individual in the community. The program targets adults age 60 plus who are in the greatest social and economic need. The program pays particular attention to low-income older adults, minority older adults, rural communities, limited English-speaking proficiency, and adults at risk for institutional care. So again, this is why we ask you all for information about these specific communities, because the OAA stipulates that those are the ones we have to target most. Obviously, somebody who is low income is going to have more difficulty getting food. So we want to make sure that they have access to food before someone who can afford food can get it. It's not to say we're not going to serve that person who can afford it. We just obviously want to look out for those that are a little more vulnerable. So that is why we ask the questions on how many people do you serve that are low income? How do you target your limited English speaking proficiencies? What are you doing in your rural communities? Again, it's not stuff just that we want to know and we're just trying to make your job harder. It's stuff that we have to report, your AAADs and TCAD. When I say we, I'm talking about the AAADs and TCAD. It's what we have to report up to the federal government. So that's why we have to ask for the information. There's roughly 5,000 providers together serving more than 900,000 meals a day in communities across the country. 900,000 meals a day. Y'all, that's massive. It is the largest program at TCAD. It is the easiest thing that we can do with provider shortages and other things. Sometimes we're limited on what we can do. Getting somebody a meal is something that we can do. That is why we talk a lot to the AAADs about spending their nutrition dollars. We don't want to leave money on the table because money that we do not spend gets sent back to the federal government. There is a potential if we're not spending the money and we're sending it back, then we will get less money the following year, which is just going to make y'all's jobs harder. So we want you to serve as many people as possible and spend your funds so we can ensure that we're serving more. The more funds we spend and the more we can show the need, hopefully, the goal is to the more people that we can serve. All right. So now let's talk about Title 3C. So as I said, nutrition falls under 3C. 3C1 is congregate. 3C2 is home delivered. And this encompasses meals, nutrition screenings, assessments, education, and counseling. So all of that falls under Title 3C of the Older Americans Act. So federal eligibility. So we have our TCAD eligibility. Let's talk about federal eligibility. The only requirement for eligibility for the nutrition program, according to the Older Americans Act, is age. the person must be 60 plus to participate. That's it. They have to be over 60. That is the only requirement that it is required. Now, Section 339 of the Older Americans Act expands it a little bit to include spouses of any age of a person age 60 plus, people who volunteer during meal hours. So if you have a volunteer in your center and they are not 60, but they are volunteering during meal hours and helping you distribute meals, they qualify for a meal, and you can count that meal as a meal. People with a disability living in housing mainly occupied by older adults. So if it is senior housing, and there's somebody that qualifies to live there because they have a disability, but they're not quite 60 plus, and there is a congregate meal site in that location, that disabled person can qualify for a meal and you can count it. And then people with a disability who reside with an eligible older adult. So let's say there's a disabled child who's not quite 60 that's living with their parents, and their parents are over 60 and qualify for a meal. That disabled individual living with them can also receive a meal. So if they bring them up there for a congregate meal, they have to be with them. They have to attend with them. They have to, for it to be counted. If it's a home delivered, obviously they have to be in the home with them. So the only federal requirement is age. A few things to keep in mind is when considering eligibility is we need to be sure to document the reason a person is receiving a congregate meal. So we're going to talk about documentation in a little bit, but just something that we always need to think about if and when we are looking to make changes, can we document this change? So if you have someone that is coming up there who is not 60, but they're with their parent that they live with who is 60, we need to make sure we document that. That this is why you're serving this person. Again, we want to try to target as many as we can, but we also want to follow the rules. So congregate nutrition, again, that's what we're talking about here. We'll do another webinar on home delivered. So congregate nutrition falls under Section 331 of the Older Americans Act. And I'm happy to send y'all the Older Americans Act. It is a ridiculously large document that is so boring to read, and it is legal jargon, and it is so hard to digest. But if you want to sit and read it, I'm happy to send it to y'all. Y'all just let me know. But that's why I'm giving you a brief overview, so you don't have to sit and read it. So the congregate nutrition section of the Older Americans Act authorizes meals and related nutrition services in a congregate setting. As stated earlier, it provides social engagement, information on health and aging, and contributes to overall health and well-being of an older adult. This is why having a congregate meal option is so important in so many areas. Sometimes these meals are the only meal that an older adult receives a day. The connection that older adult makes when attending a congregate meal is not only physical in that they physically receive a meal, it's also mental because they can interact with others. And as we all learned during COVID, the human interaction is important for everyone's mental health and well-being. Now, granted, there are some days that I do not want any human interaction and I want to be by myself. But overall, having some kind of human interaction with someone is definitely better for my mental health on a daily basis. How it works for everyone's mental health, I'm not sure. They may feel like I'm a problem and they don't want to be around me, but that's a different story. So let's get some data around congregate nutrition. In 2022, a national survey of older American participants was conducted, and some of the findings are 57% of the participants surveyed were over the age of 75. So I know y'all see this in your sites. The majority of the people you serve are over 70. Most are over 80. 53% indicated that one meal that they receive in a congregate setting provides 1/2 or more of their total food that day. Again, we take for granted that we can run to the grocery store and grab food, or we can run and get fast food. A lot of these older adults either physically can't do that or financially can't do that. And with the way prices are right now, I financially can't do that much. But so that one meal that they're receiving in that congregate setting is 1/2 or more of their total food for the day. 51% of our participants live alone, which is why social connection is so important. 80% stated that the program helped them live independently, which is what most of our older adults want to do anyways. 74% stated their health has improved. 70% indicated they eat healthier because of the program. and the education provided as part of the program. And 91% rated the meals as good or excellent. So, 70% eat healthier because of this program. So these services that you all are doing and these healthy meals that you all are providing are benefiting these older adults. They're making healthier choices because of the education that you give them, because of the information you share with them, because of the meals that they receive. It's just like forming a habit. Once you get started in that habit, you can continue to go, and it's easier to do that. So that's why it is so important that we make sure that we're having congregate meals, we're having that interaction, we're having that socialization. And if information like this is something you all would like, and you think that this would be something that would help generate interest in your congregate nutrition programs, I'm happy to put it together in a flyer or an informational piece for you to use to market it. Just reach out and let me know. And again, we'll talk about this more, but if things like this are things that you all think that would benefit, if somebody just sees the numbers, let me know that. I'm happy to, we can create one for everybody. I can create some specific ones for your area. You all know your individuals more than I do. So that's what's going to be more beneficial, then that's what we'll do. So now that we've talked about federal policy, we're going to dig down into the state TCAD policy. These are several slides we're going to go through here that's going to break down some of the TCAD policy. Most of you have probably seen Chapter 7. If you have not, it should be your Bible. It is my Bible. I have it printed out in a notebook. You can find it on the website. I can send it to you as a PDF. Now, with the caveat, it is out of date and it does need to be updated. And I have written 3 different updates for it, but it has always gotten paused for some reason, most recent being the transition into DIDD. I'm hoping that after the legislation is signed and the transition is complete, they are going to let me move forward with updating it. A lot of things happened during COVID. A lot of changes were made during COVID that need to be changed fundamentally. So for now, the way that the policy reads is what we have to go by. But just know there are changes coming, and when those changes happen, you all will be completely notified. You will have ample time to change anything if it needs to be changed. And you will be able to not be a finding if there are changes. So let's go through it. So Chapter 7, if you go onto TCAD's website, which is tn.gov/aging, and you go all the way down to the bottom, there's a little section called Policies and Procedures. And you can click on that, and it takes you to all of TCAD policies, and they're broken down by chapter. Chapter 7 is nutrition. So we're going to start with section 711, statutory authority. Subpart 1. I told y'all it's legal jargon, but the stating that the congregate nutrition is to be provided 5 or more days a week, except in rural areas where this isn't feasible. It must provide at least 1 hot or other appropriate meal per day and in a congregate setting, and provide nutrition, education, and counseling. So that is just the basics. Congregate meals, this is the purpose of the program. These are the rules. Now, these are TCAD's rules. They are not necessarily from the Older Americans Act. But this is what we need to do in our state to make sure we are providing meals. Again, sometimes these meals are the only meals that they receive. If you are not able to provide 5 or more days a week, and you are in a rural area or you've got some other kind of issues, they have to be provided in an area so that they can be attended by nutrition clients. If you and 2 other nutrition sites are in your area and one of you is open 3 days a week and the other one is open 2 days a week, then they have access to meals 5 days a week. So you're covered with that. So don't freak out and think you have to go change your policies and different things now. What you all are doing now, nobody is saying you're wrong. Nobody's saying you have to go and change it. But our older adults have to have access to food at least 5 or more days a week, except in rural areas. And if there's an exception, we can always look at those exceptions. And if TCAD approves the exception and your AAAD approves the exception, then you're able to do that. So that's just the basic statutory authority of the congregate meal program. So eligibility. If you look, our eligibility is exactly the same criteria as the federal government. adults age 60 plus, spouses of adults age 60 plus, individuals with a disability who are not 60 plus but reside in a housing facility, volunteers who work during a meal hour, and individuals with a disability in the home with an accompanying adult. It's the exact same criteria as the federal requirement. So if you have any questions, always look at your nutrition policy. We try to keep things simple and follow along with federal requirements as much as we can. Again, if there needs to be an exception, or if you're serving someone outside of that 60 plus that is considered an other, we need to document it. We need to make sure we know it, just so you all don't get dinged, so we can make sure we're getting these individuals served. So now that we understand who is eligible for a congregate meal, let's talk about how we get them registered for meals. So section 742 talks about registration. This includes the completion of a participant registration form, or a PRF, and the Nutrition Screening Initiative, the NSI checklist. These two items must be completed on file for all eligible individuals receiving a congregate meal. Even if they've only been into your center one time for a meal, you should have these two documents on them. They need to have this documentation completed, and this is how we monitor that meals are going to eligible participants. Again, there's questions on there to verify their age. They can state their age and they can show you a driver's license. They can just self-report their age. Obviously, if they come in with a physical disability, you're going to see that. If it's not a physical disability, you might have to have that conversation to find out why they, are approved for the meals. But again, you need to document it. You just need to write it on that PRF form that they're here, they're under 60, but they're a disabled child with their parent. The parent is accompanying them. They qualify for a meal, whatever that might be. The PRF has to be done on every person at least one time. It's just basic demographic information listed, age verification. Like I said, we're in the process of updating and documenting these forms and policies. So that's going to be something easier to complete in the future. But again, document why. The PRF for now only has to be completed one time. So the first time they come in, get them to do the PRF. When they come in, the NSI checklist has to be completed. And that NSI checklist is supposed to be completed every year. If, just to make it easier for record keeping, you want to have the participant complete a PRF and an NSI every year, that is totally fine. That is between you and your AAAD. The PRF is only required one time. The NSI is required annually. So I know a lot of people have those forms on the same page. So one is the PRF and on the back side is the NSI. So if it's easier to have them complete them both at the same time, that's fine. It never hurts to make sure you have updated contact information for your participants. I know a lot of times people do the NSI and they just have them re-sign it from year to year and don't do a new document. Again, as for now, that's still okay. But it has been becoming cumbersome because sometimes they're not dated. I know some of QA has been going out and there have been some questions on if they were updated, when they were updated, because the date hasn't been added. If it's easier and you want to have them do a new form annually instead of just re-signing an old one, again, that is fine if that just makes it for clean record keeping. Personally, that's what I would do if I was running a nutrition site, especially if those forms are front and back. It would just be easier for me to have them do a new one and just add it to their file, have them complete both sides front and back. But I understand we've all had habits and ways of doing things for years. And if it's hard to get out of that habit, I get that as well. Like I said, these are going to be updated when policies are updated. So there are some changes that are likely to come down the pipe. So think about it. Go ahead and kind of mentally prepare whatever you think you might need to do. But again, the PRF has to be completed for everybody. And then the NSI needs to be completed annually. Minimum congregate attendance. Each site shall serve a combined annual per day average of 10 congregate and home delivered meals. Most of you I'm sure don't have any problems getting 10 people into your congregate meal sites. There may be some of you who might struggle and have busier days than others. This is not to say you have to have everybody, you got to have 10 people every day, every time you're open. This is annual per day average of 10 congregate and home delivered meal served. So if you've got a robust home delivered meals and you're taking more than 10 out of your site, then we're okay. If your site drops below 10, you have to do a plan of correction. Now, this is not to say that you're going to get your funding ripped away from you and you can no longer do congregate meals. That's not it at all. Just let us know, let your AAAD know. They can let me know. We can have a conversation. We need to come together with a plan of correction. This is just a plan on how you're going to increase your participation. What steps are you going to take? Are you going to do more outreach? Are you going to have an event? Are you going to do an open house? What are you going to do to try to increase your participation? Then you will submit that to your AAAD. Your AAAD will submit it to me. It has to happen within 30 days of noticing attendance dropping. And then you're going to be considered under review for 30 days. Again, at the end of that 30 days, that does not mean that we're going to come in and yank your funding if your numbers aren't up. We're going to look at what you proposed. We're going to look at what you did. We're going to see if we had any change. It's possible we're going to work with you to try to make more changes if you didn't see your attendance increase or whatever. So don't be afraid to reach out and ask for help. That is what I'm here for. That is what I'm paid for. That is why I attend conferences and different things, is to help you all and educate myself, to educate the community, to help you all so we can make sure we have these sites open for our older adults. It is so important for them to congregate. So if you start having a drop in attendance and you're kind of worried about, I don't know what's happening, there's been a change, I'm seeing numbers fall off, just reach out. I'm not going to like, oh my God, this is terrible. How dare you? That's not my way of doing things. Things happen. Areas change. People move. It's part of life, but we just need to try to make sure we're doing everything possible. And if we can document that this is what we did and this is how we're working on it, then we're fine. We're covered. But if we turn a blind eye to it and be like, it'll pick up, I'm not going to say anything because I don't want to get in trouble, and it keeps on and it goes on and on and on, then that's when we have an issue, because it's like, why didn't you bring this to our attention? We could have been helping with this. So just make sure that you reach out. If you're having issues, reach out to your AAAD, ask them to reach out to me. Ask your AAAD if you can contact me directly. I don't want to step in between you and your AAAD. They are the ones that hold your contracts. For those of you that get money from your AAADs. So I don't want to step on their toes, but if it's easier and you want to go straight to me, I'm fine with that too, but please make sure your AAAD knows it. Again, not trying to get in the way of that relationship. Congregate meal service. So section 4.6, 1 meal per day, 5 or more days a week, except in rural areas. Again, just basics, meals. Sites cannot be closed more than 4 consecutive days without approval from TCAD. There is a form that is a change in meal site service form. If your site is going to be closed for more than 4 consecutive days, whether it be because of illness, construction, shortage, training, whatever that reason might be, you are to complete that form and send it to your AAAD, and your AAAD will notify me. We keep these forms on record. We save them because when monitoring goes out, if they notice in record keeping that the site was closed and they want to know why, we have the documentation to back it up. Again, it's not that we're trying to catch you in something or say you're not doing what you're supposed to do. Again, things happen. I've had sites that have sent me a form because they had pipes bust and they can't serve in that area, so they've had to move to a different location, or they've had to close down for a week to get the stuff done. That's okay. We understand that. Life happens, just like with anything else, but we need to know about it. Again, if we know about it, we can help you, we can support you. If we don't know about it, then we're just assuming you're not doing what you need to do, and we can't help you with that. So you also have to have a policy about prayer and participants' choice to pray or not, silently or aloud. Just because they're in your site receiving a meal, they still have rights. If someone wants to pray either aloud or silently, they are allowed to do that. If someone chooses not to pray, they are allowed to do that as well. It is completely up to them. You, as a nutrition site coordinator, senior center director, staff of the AAAD, cannot stand up and lead the prayer. You're welcome to join in. You can pray with them if you want to, but you cannot lead it, because then it puts the image out there that you're in support of it or you're not in support of it, whatever it may be. I know we all live in the South. We're all in the Bible Belt. And most of us, that's just a normal thing, is to pray before we have a meal. It's totally fine. But there may be people in there that have different religions and different beliefs, and we cannot force our religion and our belief on them. So you have to have a policy on it. If you want to have that policy posted that says someone has the right to pray, someone has the right not to pray, they cannot force anyone to join in with them. They can't stand up in front of the room and say, all right, we all have to pray before we have this meal, because you don't. If their table wants to do it, that's fine. Again, you just need to kind of watch it, because we don't want to discriminate or alienate anybody because they pray or don't pray. You just cannot officially sponsor it as the nutrition site. Okay. So, leftovers. This has been a really hot topic recently, because people are wanting to provide leftovers and count those leftovers. You can provide, this is in policy. It is 7407, leftovers. If you have food left over, you can call for seconds only after everybody has been served. So if everybody in your nutrition site has received their meal and they have been served and you have meals left over, you're welcome to call people up for seconds. This is to ensure that you at least have enough food for everybody there, because you want everybody to get a meal. You don't want Sally Joe to not get to eat anything, but Betty Lou over here has had 4 different meals. That's not fair. That's not the goal of the program. We don't want you to waste food, but we also want to make sure that everyone has a chance to eat. If Betty Smith gets a meal and comes back and gets a second meal, you cannot count that meal as a second meal for Miss Betty. Leftovers served to the same individual at the same meal service cannot be counted as a second meal for reporting. If you are trying to count that to get your numbers up or to get your reimbursement, I completely understand that, but we can't do that. So that's why it's good to maybe have a sign up for lunch to try to get people to sign up, so you know you're ordering the right amount of food, so you're not having leftovers. If you are having leftovers, they're manageable leftovers, and you're not losing a lot of money. Now that we've served everyone and we've called for seconds and we still have food left over, but you've got somebody that's about to leave and they want to carry it home to have it for later, they can do that, but you cannot count it as a second meal. They received it there on site. The meal they consume at the meal site is the meal you count. I don't care if they take 2 bites of it and they put the rest of it to carry home, and then they get another meal to carry home. You can count 1 meal for that person. There also needs to be a policy, and it needs to be posted or included with your to-go containers about proper reheating instructions, and that when they leave with food, it is no longer the site's responsibility for safety of the food. It becomes the responsibility of the participant. Again, you don't want somebody to go home and be like, well, the meal I got from here made me sick. You don't know what happened. You don't know if they left it in the car. You don't know if if it was refrigerated properly. You don't know if it was heated up properly. So they need to understand, if they're going to take it home, they are responsible when it leaves your doors. If it makes them sick or whatever, unless you have an outbreak of sickness in the center from everybody that ate the same meal, then that's a different story. But if they're the one-off that gets sick and they ate the meal and they took it home with them, it is not your responsibility. That is why it is so, so important to communicate this with your participants. We want to make sure that everybody is safe, everybody is well, but everybody gets a meal. Again, this is not trying to make it difficult for you to provide meals. But if we consistently have leftovers and it's costing you because you're not being able to report it and get reimbursed from it, then you need to adjust the way you're ordering. Money received for meals is to be spent properly and accurately to provide for those in our community. The more fiscally responsible we are with ordering, the more people we can serve, the more congregate people we have, the bigger those targeting those individuals we can do. Emergency meal services. So we all know that your home delivered meal clients can receive emergency meals to cover them on the off chance of weather, their meals can't get delivered, there's training days, whatever. This is also an option for your congregate meal participants. You are welcome to send them home with emergency meals if you have it in your budget and your AAAD agrees. You have to do a minimum of 3. You can do as many as you want. If you want to do 5, that's fine. But you have to do a minimum of 3. And whatever month you give those meals to your consumers is the month that they're charged in. So if April the 15th rolls around and you give every congregate meal client 3 emergency shelf-stable meals to take home, then you count all of them as 3. Betty got 3 meals, Sally got 3 meals, George got 3 meals. But they have to go in as emergency/shelf-stable. That's the difference, because they're eating a congregate meal, but they're going home with shelf-stable emergency meals. They're different in Monami. That's how you're like, well, if I can count that twice, why can't I count 2 leftovers? They're different meals. That is not to say you can count a leftover as an emergency meal. That is not the case. Don't try it. But regardless of when they're consumed, they are reported the month they are received. And they also need to be reported as an emergency shelf-stable. As with anything else, you need to follow the proper menu planning. Just do it as if you were doing for your home delivered meal clients. So they have to meet the standards. They have to be shelf-stable. They have to be labeled. And your consumer needs to understand it's for emergencies. So if the center has to be closed for some reason, if you know you're having flooring replaced and you're going to have to close the center, you can make sure they have a shelf-stable meals at home so they don't go without food. If there's weather, if there's a call in for bad weather and you're worried that the center might be closed, you can do emergency meals and send them home with your congregate meal clients. Again, it's the same as with home delivered. It is an option for congregate people. So just be sure that you document it, be sure that you have it in there appropriately, and all should be good. Nutrition education. This is important for our meal participants so they have proper understanding of nutrition-related health issues. This could be diabetic-friendly recipes, brain-healthy foods. There's a lot of information available around nutrition education. In fact, the National Nutrition Resource Center through ACL has an entire section on nutrition education, and I encourage you to go check it out. I'm going to send you the link to it afterwards. You need to do this at least quarterly. Try to do it on your busy meal days. I know that seems counterintuitive because it's your busy day and you're already overwhelmed. You do not have to provide the education. You can have somebody else do that. If your busiest days for people to come in and get meals is on a Wednesday, then try to schedule your nutrition education on Wednesday. You can do this with colleges. You can work with your dietitian that you contract with. You can do it with nutrition people that are in school to become a registered dietitian. If you have a college close to you, they can come in and present. They can provide education, whether it be a flyer, whatever it is. You have to consult with a dietitian, but you can do this. You can have somebody come in and talk about SNAP benefits. You could do a day of healthy recipe swaps. You could talk about diabetic meal prep. You could talk about lifestyle changes and habits, healthy habits, brain healthy food. I've got some information on brain healthy food around dementia. If you need that, we can get that to you. You can provide that. There's a lot of different techniques. You can have a presentation. You can just hand them information. You can make it into a game, whatever you want to do. There's ways to do it. But if you try to get it on your busiest day, not only are you going to get to count all of this for your congregate meals, but you're also going to get to count it for nutrition education. So you're doing what you need to do and you're serving as many people as you need to serve. Also, ask your participants, what do they need help with? What are they interested in? What's going to engage them? What do they want to learn about? Do they need to learn some diabetic friendly recipes? Do they need to learn how to cook a certain type of food? Maybe they don't understand how to do spaghetti squash and you want to have somebody come in and do a demonstration. What are their specific needs? And if you're unsure, again, they're your best resource of information, because if they care about it, if they're interested in it, they're going to participate, they're going to show up. That's going to help you. If you plan some type of healthy recipe swap and have it from 10 to 11, and then you have lunch from 11 to 12, or however you do it, then people might stay over because they're already there. They're going to get a meal. They'll stay over. That's a good way to get your nutrition, or to get your congregate meal numbers up. Try to plan some events around those typical meal times. Again, participant satisfaction surveys. According to policy, we have to do this annually. Be sure you're including questions around meal quality, food quality, service, value, and education. Keep the data reviewed and summarized. It's in a report with your suggested improvements. The AAADs, if they are advocating for more money or more services, they have to give us data on why they need it. If you all are needing more money to serve more meals, we need data around why you need it. If you do a survey of 100 people and 50 of those 100 people say, well, I don't like the food, that's why I'm not coming, we're not going to give you more money to do food that people don't like and people don't eat. We need to know. So you need to know what needs to be fixed. And if there's anything, you may not have anything that needs to be fixed, but if you can show the data and you can support it, your argument with the data, the likelihood of you getting things approved is easier. Now, that is not to say, don't go in and say, well, Keita said if I sent her data, I'm going to get more money to get congregate meals up. That's not what I'm saying. Because I would love to control it and I would love to send you all millions of dollars, but I have no control over that. But I can go to my bosses and I can say, check out XYZ nutrition site. They have done these surveys. They have done this data. They could serve so many more people. And look, 90% of the people that show up are satisfied. 90% of the people have changed their habits because of this. They are making an impact in this community. I say we fight for them to get more money. That is going to be an easier sell than for me to go in and say, XYZ wants more money to serve meals. I don't really know how they're doing. I don't really know if people like their meals, but we should give them more money. That's not going to work. So you got to have the data to back it up. So here's the fun stuff. What's changing? This is what everybody wants to know. So in February of 2024, ACL released the OAA final rules. There's a whole lot of changes. It's over 200-page document. If you want to read it, again, I'll send it to you. However, it's a lot of legal talk. The new regulations went into effect on March the 15th of this year, but we have until October the 1st of 2025 to have changes implemented. So when I click this next slide and you see what the changes are, do not think this is going to happen next week. With the timing of these updates and the transition and merger of DIDD and TCAD, we have not implemented any of these changes yet. But once the transition is complete and we start updating policy, providing you all with education around the changes that are happening and how they will work, then we'll have a plan of how we're going to roll it out and how we're going to change it. So things, sorry, didn't click soon enough. So a lot of things didn't change in relation to congregate meals. You still have to follow the DGAs. You still have to follow the DRIs, daily guidelines for Americans, daily reference intakes to ensure proper nutrition. I know it's frustrating because sometimes you want to do things a little out of the box, but you're limited with those guidelines. But this is, again, just to ensure that proper nutrition. Why? Because this may be the only nutritious meal that they receive. So something new. A congregate meal consumed virtually or in person is something that will be allowed. Now, this is going to be difficult to monitor, but we're always trying to encourage you to introduce technology with your participants. So if you have some tech-savvy participants and they are provided a meal and they understand how to Zoom or whatever, and you can Zoom in and have that meal with them, a volunteer, other participants, whatever, you can count it as a congregate meal. It has to be something that is documented, and it cannot be a meal that they eat with family. Again, it has to be a meal that you have provided them, either through grab and go or some other way. Someone from the nutrition program has to be involved as well. So some sites may utilize colleges to do congregate virtual eating. I know First Tennessee has worked with ETSU to do some stuff. That's okay, but somebody from that nutrition site also needs to be in and be involved. And you need to screenshot it. So similar to what you see on the screen, you can see everybody's on there, everybody's eating, showing their food, different things like that. Again, the purpose of the congregate program is to have your participants congregate, to have them interact, to have them be social. I get that this virtual congregating for your 80 and 90-year-olds, not going to happen. And that's okay. It is going to be an option. Some of your more tech savvy 60-year-old participants may be something they want to try. It is not going to be required. It is not going to be the only option for congregate meals, but it is going to be an option that will be added. So again, more information, more education, more outreach is going to be coming, but just know this is something we're looking at doing. How it's going to work, I wish I could tell you right now, but it is something that changed in the OAA. The other thing that changed during COVID, pick up, grab and go, drive through, whatever everybody called it, they became huge. They are now going to be allowed, obviously with stipulations. I advocated with ACL to get this in there. We were able to open up the number of people that we served with grab and goes tremendously, because some people just don't want to come in and have a seat and sit down and talk to somebody. But them driving through and picking up a meal, they're getting that check-in, they're getting to talk to somebody, they're having that communication. So grab and goes will be allowed, but you will have a restriction on what percentage of your funds you can spend on it. Probably somewhere around 10 to 15%. That is my guess. I don't know that for sure. That is my recommendation. It has to be a complement to your congregate meals, meaning you cannot replace congregate meals with grab and go. You can't just say no more congregate meals. We're just doing grab and go now. Not happening. Don't try, don't ask, not happening. But maybe you can say Monday, Tuesday, Thursday, we're going to have a congregate meal. Wednesdays, we're going to do grab and goes. So you can come in and pick up a meal. It's going to take a lot of documentation. It's going to take a lot of calculation, because again, there's only going to be a small percentage of your congregate meal budget that you're going to be able to spend on it. But it is going to be an option. So if you have those people that are going to be hard to reach, that don't want to come in and sit down, but they don't qualify for a home delivered meal, so you still want to make sure they get a meal, and they got to have a grab and go, there are going to be ways we can do it. We're probably going to have several more conversations about this. It's going to look different for everybody. I don't want to encourage you to offer it for every day, just because that's going to be a nightmare for you to keep up with and for tracking purposes. But it is something that is going to come out. Like I said, these policies probably won't go into effect until after July 1, when we are officially merged with DIDD. But it is, sorry guys, pushed it too far. It is something that is coming. Just to wrap up a few little things, let's get creative. Let's talk about innovative ideas. Keeping everything fresh and innovative is great. This is what's going to get your new, older generation out. Again, the Nutrition and Aging Resource Center, they have a whole section on different innovative things. Some ideas that I've just come up with while working through this PowerPoint, it doesn't have to be huge. It doesn't have to cost you a lot of money. Maybe change the setting, maybe to go from round tables where everybody clicks off to change it to more family style so people interact. Change your mealtime name. Instead of saying come to your congregate meal where they feel like they're in a cafeteria and nobody cares about them, call it Cafe 60. Call it something fun, and you have that on your calendar. Cafe 60 will be open from 10 a.m. to 1 p.m., whatever time you serve lunch. Have flexible meal hours. Sometimes you get people that want to eat a little earlier. My grandmother was one. She ate at the same time every day. Sometimes people want to eat a little later in the afternoon. If at all possible, and you can keep the food warm and you can keep it safe, try to have your flexible meal hours. Again, it kind of brings in more they're in a restaurant and it's not so institutionalized. Maybe you just need to brighten up the space. Talk to your local schools. Ask them to do murals in there on the walls. They're art students or something like that. That's going to get your kids in for your intergenerational. It's also going to spruce up your facility. It's going to get community in because the parents of those kids are going to want to see their artwork. Invite high school band members to come in and play meal music. You know how you go to a fancy restaurant, you hear flutes or violins or something. Have some kids come in and play during mealtime, especially in the summer when they're looking for things to do when they're out of school. Is talk to a florist or, as morbid as it sounds, a funeral home. Sometimes they have flowers that are donated and they don't know what to do with them. So let them know, hey, we would love to take any excess flowers and we can set up, put up a centerpiece on all of your tables or something like that. Innovative ideas does not have to be, we're completely changing everything. We're flipping everything around and making this hard. It can be little things that you can do to make it a little more appealing and feel more like they're in a restaurant. Have a sampling event. If your dietitian is wanting to try something new and she's unsure if people are going to like it, have it like for the meal that day. It's like, today we're doing a sample tasting. Give everybody a index card. Let them eat it. Let them write down what they think. Yuck, bad, needs more flavor, don't like it, don't like the consistency, whatever it is. They're going to take more pride in that, and then you can have something new on your menu. Again, work with your college dietitians and students to expand your menu. Maybe there's some new different things that falls within those DRIs and DGAs that you can do. Try to use real dishes if possible. I know that's hard because then you have to wash them. But again, maybe it's just a special event that you use, like a birthday days or something like that. You use real dishes, something like that, just to change it up a little bit. All right, I am going to exit out of this so I can see my screen. I'm going to stop sharing. All right, lots of things in the chat. Oh, that's the transcript. Just kidding. Okay. Feel free. I'm going to turn my camera back on. We are still recording. Feel free to unmute. I know we're coming up on the 2 o'clock time, so if you need to jump off, that's fine. Does anybody have questions, comments, concerns, feedback? This was great. This was terrible. This is not what I wanted.
This was great. This is Chassia from MIFA in Memphis, and I've been Director of Operations for Meals for 5 months. So this was really great. Just to really the engagement piece for the congregate sites. We're doing a lot of different little things, but this was great, helpful. Thanks.
Yay, I'm glad it was helpful. And I will send you all the chapter 7. Like I said, it is printed out in a binder on my desk, and I have so many highlights and sticky notes and all kinds of stuff. It is my Bible. I refer to it often.
Thank you.
This is Marilyn. Just want to second that this has been really great, and I love your fresh ideas. Thank you.
You're so welcome. There is something in the chat that says, are and will pureed meals ever be allowed for those who have difficulty chewing? This may be more for home delivered meals. That is an excellent question. I know that oral supplements, so like liquid meals and things like that, are something that is allowed. I feel like that if we can document why they need the pureed meal, that could be something that we could do. I will look into that. I'm going to make a note right now and get the specifics around that and see what I can get for you and get you some language on that so we can start including those if we need to.
Hi, Keita, Tanya from MIFA as well. Just want to tell you this was excellent. Thank you so much. I am excited about virtually the virtual congregate eating. I think that is like mind-blowing. And Chassia is excited to wrap her brain around it. So thank you for that. All of this was wonderful. More of these types of webinars to ask those little questions, I think would be wonderful. And so thank you for the detail around the PRFs. That
Yes.
is helpful. We are definitely wanting to, on our end, go totally electronic with the PRFs, with the electronic signatures. And so thank you for just processing that with us. And I think Chassie and I, she put it in the chat, but we were also talking about, is anybody thinking about or considering like plant-based meals?
So
We're
kind of going
starting
like
to hear people.
vegetarian or something like that.
Yes, starting to hear a
Um,
lot of people question that.
Yeah, and anybody on here that if you've done that and it's worked for you, feel free to speak up. Again, this is your opportunity to discuss. I will stay on as long as anybody wants to stay here. I do not have a time limit. You all were my focus this afternoon. So I get you all have tight schedules though. But I know that there have been some things nationally around plant-based meals and vegetarian and vegan meals and different things like that. I don't know all the rules around it. I will be perfectly honest with you. That is a new world for me. I'm not a vegan and not a vegetarian. If you look at me, you can tell that I enjoy my well-rounded food. But I am attending a nutrition conference coming up soon. It's the National Nutrition Conference, and there is a lot of conversation, and I will gather as much information as I can and bring that back. And hopefully we can look at incorporating some things. I know as long as you can meet those recommended intakes, that's why it's really important to work with a dietitian. As long as you can meet those DGAs and DRIs, I say do a vegan meal. Somebody put that they ordered frozen pureed meals for a couple of their home delivered meal participants. So there you go. Some of you can get that if you need it that way. But yeah, we can talk about different things specifically for your area, and I can reach out to my counterparts across the country to find out if this is something that they're doing and how it works for them and how they're meeting those rules. I'm definitely happy to ask those questions for you all. Yes, Emily, I will send you all the PowerPoint and I will send you the link for the recording. And I will send you the links to get to the National Nutrition Resource Center. There is also on that Resource Center website, there is something that's called I Can. It's some module training. You get certificates when you complete the modules. I encourage you all to work on that and participate in that together. It has a lot of informational stuff. Again, I know you're all busy. You all have a lot going on. I'm not trying to say you don't, but it can help you with some just different tips and tricks. And that comes from the National Resource Center. So works with ACL. So everything follows the Older Americans Act. So you won't be getting anything off the wall. I do just want to recommend though to keep in touch with your AAADs. Work with your AAADs. Talk to them. Engage them. Involve them. They don't want to be overlooked. And I'm not saying to bypass them to come straight to me, but I am a resource for you all. And I'm happy to be helpful, but I also want you to include your AAADs in any ideas that you're doing. Anybody else have any other questions, comments? So the next one that was a hot topic when we did the survey was home delivered meals. Is that something you all are interested in, going through kind of Older Americans Act, TCAD policy around home delivered meals and some different things that we can look at there?
Yes.
Perfect. Okay. I will start working on that. I think I had said we were going to do these quarterly. If you all think it's something that we need to do every other month, I'm happy to do that. If you think quarterly is sufficient, again, I know you all have a ton on your plate. So I don't want you to miss it, but I'd also want you to be sure you get the information you need. We can definitely do that and just kind of play around with it from there and see how it works out best. Again, I'm always going to record them. So you can always, every other month, have a few food service coordinators. Okay, we can look at that. And it could be something that it doesn't work for everybody, but then it works for some. And so you can always go back and watch the recording. I am going to stop the recording.